Once again, for those of you who might not know us, I am Dahlia Marin, registered dietitian nutritionist.
I'm James Marin, integrative registered dietitian, environmental nutritionist. Hi, everyone.
We are coming to you live for one of our regular bi-weekly lives where we talk all things Sibo and IBS. You guys know, if you've been following us, that we do specialize in Sibo, especially for those who are eating plant-based and following a completely plant-based or predominantly plant-based diet. That is our specialty day in and day out. We help those who are dealing with Sibo or IBS with their diets and their lifestyle, and we consult with other aspects of their healing journey. And one of our biggest passions is not only helping those who already have something going on with their gut, we are hugely passionate also about helping others prevent gut issues.
Yes.
So we love sharing tips on how you and your fam can eat and tolerate more fiber, reduce the amount of processed food in your diet, reduce the amount of toxins and other things that you are exposed to.
We can, you guys, we can be on here for hours. So today it's just going to be mainly about the differences between IBS and Sibo. We love seeing your comments and your questions, though. If you have questions, put them in the comments. Let us know. It gives us ideas for topics later on, or, we'll answer as many as possible, as we always do. And of course, we give priority to those in our membership. So those who are patients in our practice, then join our membership. So we are looking at your questions as well. So those of you in the membership know where you are and who you are. So hi everyone. And so we're excited to be here again, talking about the differences between Sibo and IBS, because there are differences and it's important to understand. So we hope in general, though, if you're watching, if you're like, man, I don't really have Sibo or IBS, or maybe I do and I just don't know it. We hope your gut is doing well. We hope you're taking this time, of, everything that's in the news and all the stress going on. And I mean, there's just so much to think about lately, it seems. So we hope you're taking time for your gut health, which is essentially your whole body health, right? Because the gut, like we say, is the nexus of all planetary health. It's really where it's at. If we take care of our guts, we are taking care of everything. So we hope you're doing that, right? And if you don't know how, then that's why you're here. And you can share this, tag someone, or stay tuned again in the next couple of weeks, and we'll be back again with another topic. So
yes, and if you want to learn a little bit more about the things that we've spoken about in the past, other topics, feel free to check them out. We have published them to our YouTube channel. You can find them on our Facebook page at Married to Health. So if you do want to learn a little bit about some of the nuances with Sibo and IBS, feel free to go back and watch some of those videos, because we have talked several times and spoken several times on different topics with Sibo and IBS. And I'm speaking about them now. I keep saying Sibo and IBS almost as if they're one and the same, which they are, but they aren't. Right. So this is confusing. It can be confusing, but IBS is known as Irritable Bowel Syndrome. And it is not necessarily a disease. It is more a collection of symptoms that one can experience. So when we're talking about Sibo, know that Sibo, small intestinal bacterial overgrowth, or it might be intestinal methanogenic overgrowth or intestinal microbial overgrowth, that is IBS. So Sibo is IBS. Not all IBS is Sibo, though. We often will have patients come to us and they're experiencing the typical symptoms of IBS, and it could be one of the different types of IBS. One might have IBS-C, where they're experiencing a little bit more constipation. One might have IBS-D, where it's IBS with diarrhea. Or one might have IBS-M, where it's mixed. Patients come to us at times and say, I have alternating constipation and diarrhea. There's not one that's more consistent than the other. Or there could be IBS-U, where maybe they don't really fit into one of those categories. They might be having completely normal bowel movements, but they are having the abdominal pain, the abdominal distension that comes with that diagnostic criteria of IBS.
Right. And so, so that's important. And hopefully that makes sense. We don't... when you turn things off, but they're not off. So yeah, so hopefully that makes sense to you all. So you realize that, it's one thing, and it's very important to understand the differences, because you can lump things together, but overall it's important to understand what is going on, what is the root cause, and what is the actual diagnosis of what you have. And like Dahlia mentioned, you can have, again, those symptoms that accompany whatever it is you're having. So whether it's a certain type of IBS or it actually is SIBO, it's important to differentiate that. And
you might be saying, my doctor diagnosed me with IBS. I don't even know what that means. Again, it's irritable bowel syndrome, and it means that you likely are having recurrent abdominal pain, on average, a minimum of once per week within the last 3 months. That's pretty non-specific, right? So you might be saying, I have abdominal pain every day, or I have abdominal pain once per week. So it's important to understand that the criteria is pretty broad. If you've had abdominal pain once a week for the last 3 months, that might speak to your IBS diagnosis. And again, if it has accompanying change in your bowel movements and your stool frequency, your stool consistency, your stool appearance, your care team might have gone ahead and diagnosed you with IBS. And like we said, a type of IBS is SIBO, or IMO, as it's sometimes known, intestinal methanogenic overgrowth. And there are different types of SIBO. So your provider, your care team might have done a breath test, or they might have done an endoscopy and taken some of that small bowel aspirate, some of that fluid out of your small intestine when they did do an endoscopy, and they might have tested if there was additional gases in your either the fluid, or that might have been via breath test. And you might have tested positive for different types of SIBO. So there's hydrogen SIBO, where you have more hydrogen producing bacteria that are present. There is methane SIBO, where you might have more methanogens, and these are not produced by bacteria. They're produced by archaea. So they're even older than bacteria, but it might be a methanogenic overgrowth. And methane SIBO is more associated with constipation. If it's more hydrogen bacterial overgrowth, it might be associated a little bit more frequently with diarrhea. Or you might have the newest type that they're really just understanding and really just being able to diagnose, which is hydrogen sulfide. So you might have excess of hydrogen sulfide producing bacteria and other microorganisms that are overabundant in your gut, in your intestines, and you might be having alternating constipation and diarrhea. And really the telltale sign of hydrogen sulfide SIBO is rotten egg smelling gas. So if you're like, man, my gas smells like sulfur, I can clear a room with it, you might want to ask your care team if they suspect you might have hydrogen sulfide SIBO.
And remember, so SIBO is this small intestinal bacterial overgrowth, but it's not just bacteria, like Dahlia mentioned, and it can be different types of microbes, which will then cause different types of gases, right? And really there are tons of these microbes. So really, when it comes to SIBO or IMO, you are getting that distension, right? You are getting that extremely bloated feeling. When it comes to IBS, you might get a mix, right? So you might get a variety of these symptoms. So these are very specific symptoms. So it's good to understand and realize that there are differences. So
and it can be frustrating because IBS is known as more of a gut to brain disorder. And so different things that can affect the gut are not just food. Certainly food can affect it. We know that to this day, patients are told, oh, it doesn't matter what you eat. You have IBS. Eat whatever you want. Eat as much processed food, eat the fried food, eat high saturated fat. It doesn't matter. Just go on, different medication that might be helpful for it. And this can't be further from the truth. We know that with SIBO, at the very least, usually it is being furthered by either dysbiosis, aka imbalance of inflammatory and anti-inflammatory microbes. And that dysbiosis might have been there from year 1 or year 2 of life, and it could have just been furthered throughout your life and furthered by stress. So dysbiosis plays into SIBO oftentimes, and dysmotility. So something affecting your motility, the movement, and really that peristaltic wave that happens within your gut. Usually it's one of those two things that is playing into SIBO the most, whether that is pelvic floor issues, it might be scar tissue that's residual from past surgeries. It might be something affecting your enteric nervous system, like diabetes, a traumatic brain injury. It might be low serotonin production because you might be stuck in fight or flight a lot of the times. So both SIBO and IBS can be affected by dysbiosis and dysmotility. So if you're given any one of these diagnoses, find out what is going on, what is really playing into it, and why.
And both really have come from a lack of fiber, right? So typically both have come from a lack of fiber, whether you were early on in age or, and really what this speaks to is a lack of prebiotic, which is then creating a lack of short chain fatty acids or these postbiotics. And so it's important to understand that you may be lacking this again isn't maybe for everybody, but for a huge majority. And what we see with the data, especially in the United States, is a huge majority of people are lacking short chain fatty acids. We're lacking necessary fiber, which then speaks to the integrity of our guts and the way our guts flow and the ecology and the population in our gut. So it's important to understand that, running away from fiber, running away from food, is typically not the solution. It could be short-term. It could be a short-term way to be helpful and aid and help you feel a little bit better. And it can be strategic for a very, very short term. But long-term, the goal is to not run away, right? We're here to say, look, the long-term goal is to bring back food, is to reintroduce food, is to understand what is going on. It's to really get to the root of it and then come up with a really healthy action plan to bring things back, to facilitate growing and nurturing your gut microbiome, to facilitate the rebuilding and restructuring and just kind of healing of your gut, whether it is IBS or whether it is SIBO, and then going from there and continuing to build. Because when you're continuing to build from there, you're going to then see just great things happen, right? You see a lot of that rebuilding go, oh, wow, my allergies feel a little bit better, or like, I'm not as bloated as often, or
my joint pain,
my
fatigue, my brain fog.
So it's pretty cool. It's pretty amazing when you see these stepping stones and these milestones and what you build over time. And typically we say, look, give yourself time, give yourself patience, give yourself understanding, because really things are very twisted out there. And especially when it comes with your gut health, for so long, like Delia mentioned, we've been hearing, it doesn't really matter what you eat, or go on a lower fiber diet, or don't eat those seeds, they're going to disrupt the gut, or, we've been told so many different things. And on top of that, you have even more people saying, no, just take these supplements, or just take this medication, or just donate this whole food group, and just do colonic. Like the list can go on and on and on, and it gives you a headache. So we get it, and that's why we talk. And maybe you're watching this and you've heard us say some of these things before, or we've spoken on this topic a year ago or whatever. But we're going to keep talking about it because we keep having so many patients just confused. We keep seeing so many of you out there confused, and it's just something that we feel really called to speak on and kind of educate on. So
know that if you were diagnosed with IBS, again, you're having the abdominal pain, you're having change in stool frequency or the form in your stool, you're seeing mucus pass from your rectum, you're seeing abdominal pain that coincides with having bowel movements. You want to understand why it's happening. So again, is it dysbiosis? Is it dysmotility? You want to understand and ensure that it's not SIBO. And if it is, you want to link up with the proper care team so you can really try to get ahead of it, because we know that there is high relapse rate. About 60% of those treated with antibiotics alone end up relapsing if they don't make any type of lifestyle change. So if you're just distressed and you take the antibiotic, it's likely to relapse and recur.
Right.
If you haven't made any dietary or lifestyle changes, it's likely to relapse and recur. So really addressing past trauma. Studies have shown that those who have experienced trauma early in life have a 300 to 600% increased chance of having IBS. So addressing past traumas, addressing lifestyle, addressing stress. It's all so, so, so important. So that way it doesn't continue to feed into your dysbiosis and feed into your dysmotility. You're getting out of that fight or flight, and you feel really great to rest and digest, feed and breed.
We've had quite a week. So we are wrapping it up on a Friday with all of you. And and so we hope this has been helpful. We hope that you kind of better understand the difference between IBS and SIBO. This will replay. You can catch us again on our Facebook, on our YouTube. We try to keep it fairly short and quick. Don't see any questions from our members, so that's cool. That happens sometimes. So we hope you understand the difference between IBS and SIBO. The next steps for you guys is really understanding what you have. If you're having gut symptoms and issues, reach out to your care team, work with the great care team, ask questions, get the necessary tests, understand your symptoms, right? Listen to what your body is saying. Symptoms are not bad. They're there, and that's your body's way of speaking to you so you can take action. So we hope you all take action. Don't wait. And just take charge of it, right?
Yes.
So
I can't tell you guys how many times I've spoken with my patients and they say, yeah, I've been constipated since I was 3 or 4 years old. And I maintained the same poor diet. I had high stress in my life. So it's so, so, so important to be addressing these. I love, love, love when I see moms come see me. Yesterday, I had a mom of a pediatric patient, and she said, my daughter's having diarrhea about once a month, and I don't know what's going on. We talked about it. We found out that she's constipated, and that diarrhea that she's having is likely overflow diarrhea from being so constipated. So mom and I talked about some foundational principles of trying to ensure that her daughter doesn't end up with dysbiosis and further gut issues. So it's never too early to get started on some of these lifestyle changes. It's never too late. We can always offer solutions. There are always different lifestyle changes, nutraceuticals, care team members that we can bring in to at least help decrease the severity of your symptoms.
Yes.
But we wish you all an amazing good gut. Yes. And we hope that the weekend is no exception to that. So take care of yourselves. We're in crazy times right now, but we hope that you continue to heal with each meal.
All right, everybody. Have a wonderful weekend. We'll see you in another 2 weeks, and we'll talk very, very soon. Have a great weekend.
Bye.